Hi everyone, I'm Michelle Braley. I'm a speech language pathologist and the lead instructor for this course. Today I have asked Rebecca Glass to join me. Rebecca is my friend and a colleague here at Spalding, where she works as a PT, and Rebecca is also a person who stutters, and so I asked her here today to talk with me about her overall experience of growing up, being a person who stutters, and also her experience working professionally. So welcome, Rebecca.
Thank you for having me.
Thank you so much for joining. I just thought it would be a great experience to chat with you and have the students hear your story from your own perspective and just get your insights into the whole idea of stuttering and what it's like to be someone who stutters.
Yeah.
So thank you again for joining.
Of course.
I'd like to start by asking just for you to describe a little bit about what your experience with stuttering has been. What was it like growing up in your childhood and how has it impacted your life?
Yeah, it's a good question. And I think that my speech it's tough because it's impacted every aspect of my life. I think it's not like some disorders or impairments where there are kind of a single aspect, but it impacts your whole life as long as I can remember.
Mm-hmm.
I began to stutter when I was around 6 years old. My older brother stuttered, and my uncle and my grandpa, so wasn't foreign to our family. They all grew out of it. I didn't, but I don't remember ever not stuttering. So I remember in theory when it began, because people began to notice it, but I don't ever remember speaking fluently before that. I began speech therapy at school in the first grade, and then by the second or third I was doing both school speech therapy and once a week private speech therapy, and I continue to do that up until my senior year of high school. So I have had a lot of therapy. I am not in therapy now, but I am always in touch with my speech and making changes throughout.
How do you feel like speech therapy intervention has changed from when you were a kid to moving through high school and even now? You and I have talked before about how there seems to have been kind of a shift in the approach.
Yeah.
So can you describe that a little bit?
Yeah, so in the past 25 years since I began speech therapy, it began a lot more as if the stutter itself was something that had to be fixed. So success in speech therapy was being fluent. They'd even look at like the percentage of fluency of a passage, and it in the years has changed that the success is more acceptance and being able to be and functional in your life and not let it hold you back. So if there are things that you want to accomplish, how can you still do that with a stutter? Back growing up, that approach that it was something to fix had a lot of long-term negative impact on people who stutters psyche, because it built a lot of shame and a lot of guilt. They would teach you these strategies and techniques that would basically hide a stutter. So for example, if I stretch out all of my sounds or if I speak to a beat, I will not stutter. But that's very exhausting.
Right.
Because you're kind of having to shape every sound and shape everything that's coming out of your mouth. It makes communication a chore, and it makes you not want to speak. A good way I've always thought of explaining it to people who don't stutter is, imagine if for a whole day or a whole year, or thinking about the whole rest of your life, if you can't ever say a word that begins with A or B or something like that.
Right, and all of the thinking that goes into that.
Yeah, so looking forward a few words and replacing words, because you can always tell that you're going to stutter on a sound like around a half a second before. So substituting out words while also shaping the sound that's coming out, and then thinking about everything that a normal person thinks about, thinking about the content of what you're saying and how people are responding and social norms and things happening. It's so much, and it's exhausting.
That's actually a really good point, because that's something that I know we talked about in our class in one of the earlier modules, is just that idea that there's so much that goes into communication besides what you're saying.
Yeah.
It's how you're saying it, it's the nonverbal language, it's the way that you structure your argument or whatever it is. And so if you add that extra level of making sure that you're totally fluent, or that everything comes out 100% perfectly, it adds almost like one more element to the cognitive load.
Yeah, yes. And I think that if I do these techniques, I'm not actually saying anything that great, because I can't think of good content.
Right. So you're focusing too much on the strategies and not on what you're saying.
And I'm not paying attention to what the other person is saying, because I'm so in my head. And I think it's such an unrealistic expectation, because all people are this fluent at some times. So to have this 100% fluency expectation when that isn't how someone who doesn't stutter speaks is this unattainable goal.
That's so true. That's totally true.
So you have,
it happens to everyone.
Different. Yeah, it's not as like, pathological, but people repeat sounds and words all the time. So it's hard to, it's impossible to meet that. And then if you're supposed to be using these strategies and you have a stutter, it's you're a failure because you stuttered, and you're a failure because you're not even able to use these simple techniques taught by your therapist.
But they're not that simple.
They're not
when you actually break them down.
Yeah. So it's kind of setting you up to just think that you're a failure. Which in your formative childhood years, it can be kind of long-term impact in a bad way.
Well, it's so interesting to hear you say that, because my first impression of you as a person who stutters, and as from a background of a speech therapist, when I first met you and started talking with you, I thought you're such a strong, confident communicator that yes, I know that you're a person who stutters, but you seem to have such a good handle on it. And we were working on a patient together, and in the room you kind of self-disclosed, just so you know, I stutter, and sometimes it takes a long time, or sometimes it doesn't come out right, but just bear with me. And you're just very matter of fact about it. And so I wonder, where was the shift from that kind of focus on total perfection and feeling like you're failing at communicating, to then becoming a really confident and strong communicator even with the stutter?
Thank you, because I sometimes have to, tell myself it's kind of a fake it till you make it thing. But I think the shift happened kind of early adulthood, early 20s, when I kind of realize that I won't ever be perfect, and not only am I not, but no one is, and that my speech will never get better. And I think that sometimes I say that and it makes other people uncomfortable, and they're like, oh no, you don't know that, but I do. Like, I'm always, it ebbs and flows, but I'm never gonna be someone who doesn't stutter. And I think once I accepted that, I was like, all right, here I am. This is awful. Like, how can I deal with this? Because I'm not gonna just hide in shame for my whole life.
Right. You can't not live your life.
Yeah, and I think you sometimes have to kind of hit that low and then figure out where to go from here. And I know that we talked about that. A big thing that was always told to me as a kid was that most people who stutter grow out of it.
Right.
And this is a childhood thing, and oh, don't worry, this will be fine. And I think that although those people, speech therapists, were in that group too, meant well, it was actually detrimental to not hitting that self-acceptance point sooner, because I was always like, oh, this, like, I'll wake up and it'll just be gone tomorrow.
I remember you telling me that when we were talking about it, was that you would wake up every morning and you were like, is today the day I'm not going to stutter? And at a certain point you have to let go of that in order to accept it and just kind of move on with your life.
But when you're 10, that's how you think, because that's how people made it sound. People just grow out of it. And I think if I was told, some people just do, but there's a chance that you won't. And like, what would happen if that didn't happen? I'd have to look at my future a lot earlier.
So do you feel like you wish in even just like your speech therapy sessions, or even when talking with family that, you know, had experience with it, you wish it was more of an honest, not too brutally honest, but that more of an honest conversation of, you may grow out of this, you may not, and we're going to kind of deal with it whatever happens.
Yes, because I think I had all these dreams and goals, which are the same dreams and goals I'm still doing, but in my head they were fluent me. And then in my early 20s, I'm becoming a PT, and I'm like, oh crap, I have to do this like this. Like, how am I gonna do that? And I think the only way I am successful in this setting and in this world is owning it and setting that example of how I want to be treated, but by showing that confidence, and if I open up that topic first, then people will ask me things, and isn't this elephant in the room, and you have to own the situation, because if I don't, my speech will. So I try and get ahead of it. I'm not always successful, but you know, it's getting there.
So one of the things, you had mentioned this to me before, I feel like this might have been when you had like a little bit of a shift in acceptance, but you had mentioned the conference that you went to that made a huge impact. So can you just talk a little bit about that?
I'd love to. So I hadn't ever met anyone else who stuttered my whole life. And I was in my early 20s, and I was going through this, like, how does everyone else do this? And I found the National Stuttering Association, which holds a yearly conference in a new place in the country each year. It's the same week in July. And I went that first time with my mom, having no idea what to expect. And I walk in this big hotel, and there are like 900 people who studied. Like I still get like, it was the best feeling I've ever had, because it was like, for the first time, I'm not just the odd one out.
Right. You're like surrounded by your people.
Yeah, and
that's a great feeling.
I remember just sitting in the lobby and just hearing people walk around me and talking, and they weren't even speaking to me, and all of the chatter had a stutter. And I realized that even if I'm with people I feel comfortable with, or my family, or people I know don't care, I'm still different. And it can wear on you.
Mm-hmm.
And it's a 5-day long conference. There are workshops all day that are about stuttering, but in the approach of like accepting it, and that there's no shame, and just stutter proudly. And then all night we just do fun things. We go out, we go on boat cruises, we go sing karaoke, because people who stutter when they sing, they don't stutter, so that's always like a hit.
It's a big hit.
A big hit. And
what's your go-to karaoke song?
I don't really like it, but I go. And it's so nice. And each year I've gone since, and it's just my time to kind of reset. And I recommend that anyone who is going in this field, or a loved one, a family member, goes. Because I think you can say that you get it, you can say that you understand, but it's so raw and it's so real. Like I cry almost the whole time, like from like happiness, sadness, like it's the most intense place. And it's the best place in the world. I love it there.
And don't you hold a position on the National Stuttering or the Boston chapter?
I'm the head of the Boston chapter here.
I love it.
Yeah,
I love it.
Yeah.
So what would you say? I think that there's a lot of misunderstanding when it comes to stuttering and fluency, and people say you'll grow out of it, and people are just trying to help. But when you're communicating with new people, or even friends and family that you've communicated with for a long time, what are your kind of biggest pet peeves that people do that they don't even realize they're doing?
I hate when people finish my sentence. And I think there's a difference, and you can tell because it happens a lot when people are finishing it in like the normal way that people do when they're excited.
Right.
And in the sense that they're like helping me.
Right. Right. There's one thing if you're like vibing on a topic together, and it's
that
guy. I want pizza, you want pizza.
Yeah.
But when they're like, let me help you finish that.
Yeah.
Yeah.
Because it makes it feel like I can't do it. And is it really that much to ask for people to just wait like a half a second longer? And I think that our society is so go, and we are asking people to kind of slow down and listen. In the same way,
which is not a bad thing.
It's not a bad thing.
Yeah.
In the same way that when I stood, like sometimes people like use my block as a time, like check their phone. And
no, really?
Yeah. And I hate that.
That's like a pet peeve of mine anyways.
Yeah. Other things, I think
they're just like, oh, while you're blocking, I'm just going to multitask.
Just multitask. Yeah. People are just like, there's this thing that happens every single time I meet a new person where they have like a half a second of like confusion, like they kind of cock their head, and then they realize what's happening, and then they realize that they've been giving me an odd look, and then they compensate, and they're like,
and they overdo it a little bit.
They overdo it, and this oh, if I act so interested, she won't notice that I was like looking at her honestly. And I know that that's just all like human nature, and I know it's not their fault, and they don't know what's happened, and like, I don't know, and but when that happens like 15 times a day, you're like, oh my god, okay, here we go. Yeah. And the whole thing happens in like a second and a half, like no one else even notices it. And another thing is, I just had one. Was there anything I told you about?
Oh yeah, when you self-disclose to people.
When I self-disclose and they say that it's okay. And I'm like, yeah, no, it's okay. I wasn't asking you permission to speak. I was just telling you. And I know that again, that isn't how they mean it. I think they just don't know what to say. But they're like, oh, it's okay. And I've even sometimes been like, yeah.
Yeah,
I know.
It depends on whether you're like ready to take that fight on that day,
totally,
or just let it go.
Yes, which I think we talked about as a whole other thing, that like sometimes I feel like I am like the savior of my people, and I want to help and educate world, because I think a lot of the things I said are not people being mean, they just don't know. And the more people you educate, like how can I complain if I'm not teaching?
Right, but sometimes it's hard to be the champion.
Sometimes it's hard to be the champion.
You just want to live your life
all the time.
Right,
and I think sometimes I do, and sometimes I don't.
Yeah.
And sometimes I'm like out to eat with my friends, and I don't want to like educate the waitress at that moment.
Right.
And I think that's okay. And I have people I know who stutter and they get like guilt that they're not always educating, and you don't have to. It's exhausting as it is. You don't always have to.
Right.
Be helping.
Right.
And I think I said that was a tough thing for my friends to learn, and my fiance to learn that just because I don't want to doesn't mean I want them to.
Right.
Like,
they don't have to like
need
stand up for you or come to you the rescue.
Yeah, like I'm fine.
Yeah.
But that they get so mad, and it's like, let's eat our food and go back. So it's tough.
Yeah. One of the things that you told me about that I thought was super interesting, because I had never really thought about it as a speech therapist. So was kind of how exhausting it actually is.
Yeah.
And so can you talk a little bit about that, the secondary behaviors and like the physical toll it takes?
So I think that I always surprise people when I say that like stuttering can be painful. And it's not like a sharp pain, it isn't, but it's this dull, throbbing pain. And I'll go home and my face hurts, my jaw hurts, my neck hurts. I have had a bad secondary of like twitching my head like that. So I'm constantly tightening up this side to hold my head in the center. So here it just aches. Also, my jaw, like my muscles here, are so tight all the time because they're just like quivering all the time. And my jaw on this side, it pops.
Oh, really?
In and out, which is just because one day I had this like really bad block because I twitched, and I was like 15 years ago, and it popped. And then now it just pops every time.
Really? Does when you do the like the massaging, does
Yeah.
that help? Or only for the moment?
Only for the, like, I do it on the train.
Mm-hmm.
I just sit and I rub my face. People must think I'm like all crazy. It feels really good,
Mm-hmm.
but I haven't ever really noticed it helps. However, no one's ever like taught me how, so
Right.
I don't know. I could be. I just kind of rub my jaw.
Mm-hmm.
And I'll look at if my neck and my jaw gets tense, I'll get a headache, like a tension headache. Kind of like in the back here, up here. And I don't think people get that it's a physical reaction.
Mm-hmm.
It's not just it's hard to get out of sound. It's my whole respiratory system, my throat, my head, my eyes, like spasming every time I speak. So it's exhausting in that way. I also, for a bad block, you can't breathe. You can't get out any air.
So that's kind of scary.
It is,
Or no,
but I
is
think
it
I'm
not?
used
You're
to
used to it?
But it doesn't scare me in the sense like I think I'm gonna, pass out. But I get sometimes like an automatic response, like my body thinks I'm choking. So if I have a bad block, I get kind of sweaty. I always have deodorant with me.
You said that when you go home, Trevor's like, you had a tough day.
He's like, "What's smelly?" Because it gets this like fight or flight, like you're not breathing, and I sweat. I'm sure I'm sweaty now from this, and you get this like kind of like spasm choking thing, which isn't enjoyable.
Right, and exhausting.
Yeah.
So, thank you for sharing all of that.
Of course.
I think this is just so helpful to get kind of like a real perspective on what it's like to be, it's your whole person. This is an element, but it's also part of your everyday life.
It is. It impacts, I think that's the biggest thing, is that you're not treating a repetition or a block, that it's impacted my self-esteem, my relationships, my self-worth, my confidence. Like it's think of every single time an interaction you have communicating always, and it impacts every single one of those times.
Right.
Like a job interview, like a first date, like a saying thank you when you leave the bus, like all these things. It's always
and these things that you normally don't even think about. So we've got a group of budding speech therapists watching this video. What's one piece of advice or wisdom, or if you could help kind of guide and mold the future generation of speech therapists, what's something you would, I know it's a lot of pressure, but what's something that you would, just want to have them take away from this? I mean, there's a lot to take away, but is there anything else that you would want them to consider if they go into this field, or remember when they're working with patients or people who stutter?
I think that you have to teach that success isn't fluency, and because once that's ingrained in you, it's so hard. Like I'll do a presentation here, and I'll go home and I'll measure how successful that was based on my speech. And even now at 30, I'm like,
not even about what you talked about, but how fluent you were.
Because I had, it's not even, I'm like, no, that was fine. Because I know how to be a PT. I just don't know how to talk yet.
Well, you know how to.
I know, but like that's the
that's how you talk to yourself.
Yeah.
So we need to positive self-talk.
Yes, and that success isn't fluency. Success is reaching your goals anyway, and achieving what you want anyway, and figuring out how you can do these things and stutter, and that I am not my stutter in the same way that we all have traits. Stuttering is just a trait of mine, and that it can kind of hinder things, but it doesn't get to take control, and that as a speech therapist, you have to teach and help foster how the person can take control and not let it run the person.
I love it.
That's the
Yes.
thing.
So remember that, okay? Rebecca, thank you so much.
You're
This was so
welcome.
wonderful to hear your thoughts. And well, you and I will be talking
Yeah,
again.
absolutely.
But if there's any questions that anyone viewing the video has, send them to me and I can pass them along to Rebecca.
And we have our Q&A.
And we have our live, yes, we'll have a live Q&A with Rebecca too. So get your questions queued up and prepared, and you can just pepper her with questions.
Yeah, absolutely.
All right, thank you.
You're welcome.